Presenting Zoin, a revolutionary topical skin adhesive from Astrum Healthcare. Zoin is a safe and a painless alternative for sutures and staples for closing wounds, lacerations and surgical incisions. Closing wounds with Zoin saves time and is a convenient option for both doctors and patients. Zoin contains the monomer N-butyl-2 cyanoacrylate, used successfully throughout the world over the last 30 years. Zoin exhibits a high degree of mechanical strength in wound closure. The successful application of N-butyl cyanoacrylate as a topical skin adhesive has been described in more than 1,000 publications. Zoin is a single-use ampule in individual foil peel pack to maintain absolute sterility. Though the single most distinguishing factor that sets Zoin apart from the rest of the tissue adhesives is its technologically superior delivery device. The Zoin device comes to you with a worldwide patented micro-delivery system. This device is an ingenious assembly of a thin glass ampule containing the adhesive blue liquid, a polymer jacketed sheath, a polypropylene microfilter, and a soft polymer tip for micro-drop delivery. The Zoin device is designed to offer you many advantages. It maintains the sterility and the long-term stability of the product. It enables storage at room temperature and makes it convenient and easy for you to use. Zoin is blue in color, hence it is easily distinguishable when applied. Zoin is used to close wounds that are uncontaminated, in the area of minimal or no tension, and the edges of which can be closely approximated. Let us now see how this wonderful product Zoin works. Wounds should be cleaned and dried completely. Now remove Zoin from the peel pouch and hold the device between your forefinger and thumb. Firmly press in the middle to crush the glass ampule inside, releasing the liquid adhesive into the plastic jacket. Please note, once the ampule is crushed, it should be used immediately. Using your gloved hand or ideally with forceps, bring the edges of the wound together closely and precisely. Invert the Zoin device over the site of application and by applying controlled pressure on the plastic jacket, release the liquid adhesive drop by drop throughout the length of the closely approximated wound edges. Avoid the tissue adhesive flowing into the wound. Keep the wound edges aligned for about 1 minute. When applied, the monomer N-butyl cyanoacrylate comes in contact with the skin moisture and chemically changes into a polymer, which forms a bridge binding the wound edges together. Once the transparent film becomes opaque, tissue bonding is complete. Zoin forms an antibacterial film which protects the wound against infections, and an additional dressing is not required. But to protect the wound site from any external injury, you may cover the wound closure site with a dry gauze. Do not use any anti-infective ointment to cover the wound over Zoin. Zoin sheds off the skin within 5 to 10 days, requiring no further medical treatment. Zoin leaves minimal scars after complete wound healing, thereby enhancing the cosmetic outcome. Zoin is simple to use and effective. In emergency setting, to repair lacerations, an injection of local anesthesia is not needed. Moreover, the additional procedure of suture removal is totally done away with. After using Zoin to close wounds, the patient may take a bath without any worry. In case of an accidental misapplication of Zoin, application of acetone, commercially available as nail polish remover, on the already set Zoin film does the trick. Simply apply a swab of acetone to gently loosen the film. This may be particularly useful in case of any further wound treatment. Zoin, the quick and easy alternative to sutures and staples, is available in 3 strengths. 0.15 ml, which closes up to 3 inches. 0.25 ml up to 5 inches. And 0.5 ml up to 7 to 8 inches of wound size. For closing wounds, cuts and surgical incisions, choose Zoin and enjoy the benefits of the superior wound closure technology.